what makes St. Vincent's unique is getting in early, providing those services up front, providing that safety net, changing behaviors before they get to a point where they're out of control, and then you try to go in and provide prevention and do the services. It's too late then.
Since 1875, children have always been the primary focus of St. Vincent Family Center. Founded as an orphanage, St. Vincent Family Center evolved in the 1970s into a premier behavioral health facility. Today, St. Vincent offers prevention and intervention services with the mission of making good kids better by providing pediatric behavioral health care within a learning community to change the lives of children and families. From our founding to our present-day mission, our main goal has been the health and well-being of the whole child while strengthening families facing difficult circumstances. St. Vincent Family Center provides services from birth to 18, and we specialize in young children who have severe behavioral health challenges at home and in school. Typically, our children experience chaos in the home, or they've been expelled from school or even preschool. In many cases, St. Vincent Family Center offers services that cannot be found anywhere else in Central Ohio. Children come to our agency with varying degrees of issues. Some needs are met with more intensive services, such as our residential and therapeutic day programs. For others who don't need a high level of care, our outpatient and community support services fulfill the critical needs of our children and their families. Intervening when a child is young and getting the family on the right path is the key. Children and families who seek treatment at St. Vincent Family Center are taught life skills that help them overcome barriers they face, in school and at home, strengthening relationships with their families. Our goal is to provide them with tools that will increase their self-esteem and build their self-confidence for life. We do this by providing a safe and comfortable environment with trusting clinicians and committed staff who empower them and help them succeed. Our agency serves 2,000 families per year. We have a 93% success rate in integrating preschool children from our services back into their traditional preschool. The earlier we work with the child, the higher the success rate. We have an 87% success rate in integrating school-age children from our treatment services back into their schools and communities. At St. Vincent, we provide unique programs in Central Ohio and throughout the state. Our agency has built a special trust among the Hispanic, Latino, and deaf communities. We've done this by using trained clinicians fluent in Spanish and sign language who are culturally competent. In many cases, our clinicians providing services to the deaf and hard of hearing community are also deaf. James is 7 years old and has already had a very difficult life. He was abandoned at the age of 6 and had never been taught to communicate with the outside world because he is deaf. Once Dagny, his foster mother, took him in, she reached out to St. Vincent for help.
So we're really encouraged that he is working with a deaf aide here, which is awesome because he's getting the communication with another deaf person, or he has a deaf mentor, which is nice because since he is deaf, it's nice for him to see, hey, there's other people like me that are stable. You know, having a deaf aide is great for him because he also learns more sign language that way.
A small change makes a big difference. As the community needs have grown and changed over the years, our agency has adapted to meet the demands of our families by providing a continuum of care ranging from prevention to residential that helps the entire family.
It was rough. It was rough. I had ADHD, attention deficit hyperactive disorder.
At the age of 7, Cornell was struggling at home and in school. He came to St. Vincent and found help in our residential unit, where he lived for 1 year.
I'm just intrigued by every time I go by here that they're still here. So I think their longevity speaks a lot because I know in the Black community, one of the biggest things that is huge for people is longevity. You come here, but are you going to stay? And if you stay, what are you going to do while you're here? And so to me, that means a lot to the community.
Because of the uniqueness of our programs, children are waiting to receive our services that cannot be found anywhere else in Central Ohio. In many cases, we are a family's only hope. Children are our most vulnerable, and if we can't care for them, then what would we say about ourselves? It's important that people get involved with St. Vincent. We're providing an incredible service to their children because they are the community's children. We are all responsible for them.
I think when you're a volunteer, you have to find a passion and really connect with the organization. And for me, these kids they just touch me. I'm going to cry talking about them. They have been through so much, and they're such great kids. And just one simple thing for them, just a comforter, or having someone give them a stuffed animal, or go out of their way to make a treat for them, means the world to them. I can help these kids now, or I can help them in the prison system, or in a homeless shelter, or in a mental facility 20 years from now. But if I help them now, I can help them be productive, happy members of society.
What can you do? Volunteer. Get involved. Spread the word. Help change a child's life. When you become a partner with St. Vincent Family Center, you are giving hope to families and helping to make good kids better.
I think it simply offers children and families hope. A lot of kids and families that come to us are broken. And to be honest with you, years and years of going down the path of being broken and not having services, or not having a support group or a safety net. The one thing that I would like people to walk away with is that we provide hope for children and families. Not only will they get good services, but we will be able to give them a brighter future.